welcome to a Business Minute with Lily Lopez, presented by the South Florida Hispanic Chamber of Commerce. I'm here today at the beautiful Biltmore Hotel. We're celebrating our 11th annual Heart Disease Awareness Lunch and Panel Discussion. And with me is Dr. Hernando Torres, who is a cardiologist with Mount Sinai. And Mount Sinai happens to be my hospital. I'm a block away. Usually I get mail from Mount Sinai because I'm at 4300. It's really a nice thing to know that, it's comforting that I have a hospital a block from me.
Absolutely.
So, Dr. Torres, I'm so honored that you accepted to participate in today's panel. So tell me a little bit about your story, where you studied, and what are you going to talk about today?
Absolutely. I'm originally from Ecuador. I completed my training in a small city called Cuenca. Once I completed my training, I moved to the States in 2014 to enroll in the USMLE pathway, and I was so fortunate to finish my internal medicine training and cardiology at Mount Sinai Medical Center. Currently, I'm a board-certified physician in internal medicine, general cardiology, echocardiography, and nuclear cardiology.
Okay. My heart's pounding just to think of all those things.
And of course, on top of it, I'm being extremely lucky that now I'm part of the cardiology group. I'm based at Hialeah, so that's my clinic 5 times a week.
Okay.
My talk today is going to mainly focus on primary prevention.
And what is primary prevention?
So primary prevention is to address risk factors that can impact in the cardiovascular system.
Blood pressure,
diabetes management, weight, importance of exercise, salt intake, importance of medication compliance. So now the medicine has evolved, and I'm going to tell you that about 60 to 65% of the population that I see in Hialeah are over 85 years. So that's telling at 85 years old.
So, yeah, people are living a lot.
Exactly.
Especially Hispanics, because we have a lot of family. And I know that usually when you have a lot of family and people take care of you, you live longer, as opposed to when you're lonely.
When you have a really good social support, medication compliance, good follow-up, and that's what I think it's been happening. Now we have a new trend, so people tend to live longer, and the best that we can do is prevention. So that's what I like the most.
Dr. Torres, I have a question. What is overweight? That like 10, 20 pounds above what you should weigh? Give me a ballpark so we could tell our viewers.
Absolutely.
Because sometimes people say, oh no, I'm not overweight, but you look at them, you don't want to say anything, but you do see that they're a little bit overweight.
Absolutely.
And that tends to, after that you get high blood pressure, you're at a high risk basically.
Exactly.
For high blood pressure.
So the definition of overweight, we use an index that's called body mass index.
Right.
That's
the BMI,
ratio.
The BMI.
That's the ratio between height and weight.
Right.
Anything that's more than 24.9, 25 to 29.9 is considered overweight, and anything above 29.9 is considered obese. And then, of course, we can classify obesity based on the index in the body mass index. But as you mentioned, the weight is a risk factor, not only for hypertension, but also for glucose intolerance. Patients
That's my next question.
Pre-diabetic.
It all goes to pre-diabetic. Okay.
Correct. So the people that tend to be overweight and obese, they tend to have a lot of abdominal fat. And there's a really good correlation of abdominal fat and fat that actually is deposited surrounding the heart. Right. So there's been studies that have shown that this fat is responsible for the release of inflammatory cytokines. And inflammation is the main factor that trigger plaque buildup. So that's really interesting.
This is so interesting, and you're going to address all of that today.
Absolutely.
And you know that this is a business minute, usually 5 or 6 minutes, but just having you here, and for our viewers, it's good to hear this all the time, because sometimes people that never think about heart as being the number one killer, they think of cancer. Because heart, I always say it is such a beautiful, it's Valentine's Day heart, it's love heart, so the heart won't kill me. And that's the number one killer for both men and women.
Absolutely.
And we know that, and I keep saying that to everybody.
And
I've learned through the years with having doctors such as you today.
Absolutely.
So I want to thank you so much.
It's a pleasure
I look forward
being
to
here.
hearing you speak
Absolutely.
at the Chamber's luncheon today. And then I'd like to
such
shake
an
your
honor.
hand.
Okay.
What a pleasure to see
Absolutely.
such a young doctor, so qualified, and right in the heart of Hialeah with Mount Sinai. In the heart con los hispanos.
Absolutely.
La ciudad menos diversa de
La
Estados
ciudad
Unidos.
que siempre progresa.
Siempre progresa y menos diversa porque hay más hispanos que nada.
Absolutely.
Y los amamos a todos en Hialeah.
Absolutamente.
Gracias, doctor. And thank you so much for tuning to another episode of A Business Minute with Lily Lopez. We'll see you next week. Thank you.
Have a nice day.